Chronic kidney diseases, CKD, in dogs and cats. This is a kidney disease persisting for over 3 months. It's more common in cats than dogs. In the pathophysiology, we can see nephron loss. This is due to a reduced glomerulus filtration rate, which leads to fibrosis. And cats get tubulointerstitial nephritis, which has a less chance of developing proteinuria, whereas dogs get glomerulopathy, which leads to proteinuria. And hyperphosphatemia can cause chronic kidney disease. So retained phosphorus causes soft tissue mineralization, and this causes secondary hyperparathyroidism and renal osteodystrophy. For the clinical signs of chronic kidney disease, we can see polyuria, polydipsia, dehydration, weight loss, and inappetence. In the advanced clinical signs, we can see anemia, hypertension, blindness, and central nervous system signs, and GI issues. The staging of chronic kidney disease can be based on creatinine levels, the urine protein creatinine ratio, or blood pressure categories. Basing on the creatinine levels, there's stage 1, 2, 3, and 4. Stage 1 is no azotemia, stage 2 has mild azotemia, stage 3 has moderate azotemia, and stage 4 has severe azotemia. And staging based on the urine protein creatinine ratio, so less than 0.2 is non-proteinuric, 0.3 is borderline proteinuric, and over 0.5 is proteinuric. And staging based on the blood pressure categories, so less than 140 mmHg is normotensive, 160 mmHg is moderate, and over 180 mmHg has a high chance of damaging the kidney in the future. For treating chronic kidney disease, we need to eliminate the cause if possible, manage the symptoms, and prolong the quality of life. Important interventions include giving a diet of low phosphorus and high omega-3 and vitamins, as well as having phosphate binders such as calcium carbonate, and antihypertensive drugs such as enalapril, and to treat anemia using iron supplements. For glomerular diseases, the causes are immune complex glomerulonephritis, which is caused by neoplasia, and non-immune complex nephritis, which is caused by toxins and glucocorticoids. And amyloidosis can occur in Shar-Pei's and Abyssinian cats. The signs are severe proteinuria, hyperalbuminemia, and hyperlipidemia and edema. In nephrotic syndrome, this is severe glomerulopathy with severe proteinuria, hypoalbuminemia, hyperlipidemia, edema, and ascites. For the diagnostics, we'll see severe proteinuria and an increase in the urinary protein creatinine ratio, as well as seeing hypoalbuminemia. For the treatment approaches, for proteinuria, have a renal diet with omega-3 supplements and ACE inhibitors such as benazepril. For hypertension, you can give amlodipine, and for anticoagulation, give aspirin. And for anemia, give erythropoietin and iron. Other conditions are hydronephrosis and pyelonephritis. Hydronephrosis is renal pelvis dilation. It's due to an obstruction. And pyelonephritis is renal infection. The treatment is long-term antibiotics and do a nephrectomy for unilateral unresponsive cases. For monitoring chronic kidney disease, have regular creatinine checks, as well as checking the urinary protein creatinine ratio, as well as blood pressure checks, and assess the hydration and anemia. And for the prognosis, early diagnosis, as well as strict diet and controlled proteinuria and hypertension can improve outcomes.